This bill has new work requirements that target Americans who get health care through Medicaid.
A Medicaid work requirement.
Work requirements and Medicaid.
We've been hearing that term a lot lately, but what exactly are Medicaid work requirements and how will they affect Americans? Here are 4 things you need to know. President Trump signed legislation that mandates some Medicaid recipients prove they're working, volunteering, or completing other qualifying activities at least 80 hours a month to maintain coverage. This applies to 40 states plus Washington, D.C. that have expanded Medicaid to a broader pool of low-income adults. These states will share $200 million to prepare eligibility systems. Medicaid offers services primarily to people with low incomes and disabilities. It's not to be confused with Medicare, which is mostly for people 65 and older. Work requirements have mostly been pushed in Republican-led states, with some initially approved during the first Trump administration. Arkansas and Kentucky tried or proposed such programs, but their efforts faced legal challenges and were blocked by courts. Georgia runs the nation's only active Medicaid work requirement program, but people have had trouble proving they're working. As of late June, just over 8,000 Georgians were enrolled in the program. More than 300,000 would be eligible if the state fully expanded Medicaid. Plus, the verification process is expensive. The program, which launched in July 2023, has cost more than $100 million, with only $26 million of that spent on health benefits. GOP lawmakers say they're encouraging employment among low-income adults who rely on Medicaid health coverage.
Remember, it's the Democrats who put millions upon millions of healthy working-age adults onto Medicaid. Many of them absolutely refuse to work.
But evidence suggests that work requirements don't significantly boost employment. In fact, most people under 65 on Medicaid are already working or would qualify for an exemption. Georgia's work requirement program has led to a small number of people gaining coverage, while thousands couldn't meet the paperwork demands. In Arkansas, the only other state that has tried it, 18,000 people lost Medicaid coverage for not complying with the new rules. Red tape is effectively keeping people from obtaining life-saving health benefits. Critics say work requirements also limit many low-income families. If they earn too much, they lose access to Medicaid. But the jobs they find might not offer health insurance, and it can be too expensive to purchase it independently. The new requirements mean that 40 states and Washington, D.C. will need to prepare technology by the end of next year. The massive new bureaucracy will process the information that Medicaid recipients will have to regularly file. We'll keep you informed on the latest in health policy news. Don't forget to subscribe.